In an era of healthcare where we are challenged to do more with less, to do it faster, to do it better, I am very proud of the nursing team at Kalispell Regional, who never forgets that our patients come first. Our nursing mission statement that was created only recently by the staff themselves pretty much says it all. Excellence in care, every patient, every time.
My grandmother was a nurse, and she would do private duty, and she would go into people's homes and take care of them at home. And she was old-fashioned. She'd wear her white dress and her cape and her white hose and her hat. And sometimes she would bring me with her when I was a little girl, and I would sit in the person's living room and watch TV while she went in and took care of whatever they needed taken care of. And I didn't really know what exactly she was doing, but I knew she was taking care of somebody and helping them. And I always thought that was just the neatest thing. And I always thought from the time I was 6 years old, I want to be like her, and I want to take care of people and help them when they need it.
The reason why I became a nurse to begin with was that my parents were both nurses. My mom was a public health nurse, and my dad was a CRNA in a small hospital. And their conversations at home made me realize that that was absolutely what I wanted to do. And I've never been sorry.
Did a number of different things until my early 30s. And that's when I realized, yes, Mom was right. I really did need to be a nurse. That was pulling at my heart.
When I was in high school, I had a close friend who was in a horrible car accident and was in the ICU in my little hometown in Montana. He was on a ventilator and wasn't responding at all. He was in pretty rough shape. He actually coded a couple times while I was there visiting him, and I didn't know what that was at the time, but was quickly escorted out of the room while they took care of him. They flew him out to a medical facility. That night they got him out of our little rural hospital in eastern Montana, and the next day he called me on the telephone. And I thought, wow, I need to be part of that. I need to be in that profession.
We're a team here, we're a family. We have support from administration, management, our peers. And it really does feel like a family. Some weeks I spend more time here than I do with my family. So you have to like coming to work. You have to like your job.
There's a lot of times you're over at Walmart, people come running up, Mike, my nurse Mike, you know, and so they remember you. It's more than a job, you know. These people love their job, and it's a career. And that's kind of why I work here. I mean, I've never had a day yet in 12 years that I said, bummer, I got to go to work.
I am always amazed at this staff, their commitment, their dedication, their clinical expertise, their involvement in the community.
One of the reasons I love nursing so much and this profession so much is I find that there's so many different fields of nursing, different avenues you can take in the profession, and you can really find a place that you love.
At this age, I still am excited to come to work every day. It's a wonderful field to be in for somebody who likes to constantly learn.
I just took care of a patient yesterday on the floor, and I was leaving her room and she said, I can tell you really like your job. And I said, I love it. You know, thank you. I'm glad that's coming through.
You know, as a nurse, you are the eyes and the ears 24 hours a day, 7 days a week for patients. Everybody else goes home, but there's always a nurse at the bedside. You know, in the ER, the nurse is the one that greets the patient, treats the patient, and sets their prioritization as to when the doctor sees them. And so you have a lot of impact making sure that the doctor gets to the right patient at the right time.
What we do as nurses affects patients' lives for not only the near future, but far into the future, such as for this little girl. It affects her for the next several decades, her entire family, and our entire community. This is the reason I come to work every day, and I've loved my job for over 30 years.
I won't be paying student loans until I'm 80, but it's well worth it.
It isn't always about how expert we are at the clinical processes that we know and deliver in our care every day. What people appreciate most about our nurses is that they do the little things well. They remember to bring the warm blanket after surgery and the ice chips that they so need to wet their mouth, and all those little things that provide comfort.
I think having a good nurse makes all the difference in a patient's healing. If they feel that they're well taken care of and they're in good hands, they feel more comfortable and more likely to participate in their care and have a positive attitude about their well-being. Taking care of patients can be a real honor because you're helping somebody at a very bad time in their life, what could possibly be the worst time of their life, and having someone that's smart and knowledgeable but caring and kind and compassionate at the same time can make all the difference in their recovery.
When clients come to Pathways, we want to give them an environment where they feel safe and they feel that their needs are being met as far as what their health issues are. But we also want to provide them with an environment where they feel comfortable approaching us and talking to us about their needs.
We usually see people at some of their very worst times of their life, and they're scared and they're hurting, or they're unsure of what the future is. And number one, what they want from you is honesty. They want sincerity, and they want to know that you love what you're doing and you're doing it because you know you can make a difference for them.
3 years ago, my father was dying. I did not hesitate to bring him here, not because of the quality of the surgeons, but because of the nursing care that he would need in the ICU and that he would need in the operating room in the recovery area. The people that transferred him here and where he returned for his care for the rest of his life often called and said, "What kind of hospital is this that we had to transfer to you?" I knew the difference had to be with the nurses.
Back in 2004, Jacob Veitner fell out of a canoe. He drowned, had 2 hours of CPR, core temp of 69 degrees, and I was fortunate enough to be part of that team that saved his life. Every time that I get an email or see a picture on Facebook, it just brings a smile to my face to know that I was part of that team.
A mother who was ready to deliver within weeks was standing at the post office ready to send some Christmas cards and began having chest pain. Fortunately for her, an EMT was in line behind her and noticed the symptoms that she was having. She went to her car and got some oxygen, called 911, and the patient came to the emergency room. She was having a heart attack at the time. Within minutes, she was in the operating room where people rallied, ICU nurses, IMC nurses, OR nurses, perfusionists, cardiac surgeons, obstetricians. Everybody was there in a moment, and we delivered a healthy Joy Grace, a tiny baby, and then Dr. Kirshner went on to do her heart surgery. A few days later, this mother walked out with a healthy baby because the team rallied to take care of their own. This would not have happened in a major city, but it happened in Kalispell because of the nursing team and the medical staff, their collegial relationships, of their commitment to the community and to our patients.
True nurses become very involved with their patients because they do look at them as if they are one of their own family members. I don't think there is a more prestigious role out there than being a nurse. And I've loved every day I've done it, and I'll love it until I quit doing it.